Hi, my name's Louisa, and I'm a harm reduction health educator at MaineGeneral. This video series covers roots of substance use, and today I'll be talking about smoking. In this video, we'll learn about how the smoking high works, talk about some commonly smoked substances, and I'll describe how things are smoked. Then we'll discuss the risks associated with smoking, and I'll provide some risk management tips. So smoking is when you burn a substance and inhale the gas it creates in order to get high. Substances that are smoked pass through the lungs and are absorbed quickly into your bloodstream, so you can feel a high in as little as a few minutes when you smoke something. This is a lot shorter than the potential hour-long wait you might have when you swallow something. This time estimate changes based on the type of drug that's used, the amount that's used, and the body of the person smoking. So some commonly smoked substances are tobacco, marijuana, heroin, crack, meth, pills, and more. Substances can be smoked in a variety of ways. Drugs like crack and meth are generally smoked out of a glass or metal pipe, while heroin can be burned on a tin. Pills can be crushed and rolled into rolling papers. And tobacco can be smoked in the form of things like a cigarette, cigar, or in a pipe. Marijuana can be smoked through a joint, bowl, or bong. So people might smoke a substance in order to avoid some of the risks associated with other methods of use. But there are risks associated with smoking as well. When you smoke, the substance enters your bloodstream through your lungs, and this causes a strong high because the substance isn't filtered in the same way it would be as if you'd swallowed the drug. This increases the risk of overdose, and it also means that the high will probably be shorter. There's also a risk of Hep C and HIV when smoking. And you can get these if you have an open burn wound or share pipes with somebody who also has burn scabs and can share blood. Some other risks associated with smoking are lung damage, asthma, bad breath, mouth rot, burns and scabs around your mouth that can get infected, and more. But there are a few preventative steps you can take to reduce these risks, which include using the low and slow method, practicing appropriate hygiene, using the proper materials, and rotating routes of use. Since you can more easily overdose when smoking in comparison to taking something orally, make sure, if you can, to use the low and slow method. Start out smoking a small amount of a drug and wait a good chunk of time before you smoke more. You can always take more once a drug has kicked in. Additionally, by waiting until your pipe has cooled down in between hits, you reduce your risk of burns and scabs. And if possible, always be sure to have Narcan on hand and a friend nearby in case of overdose. Even if you don't think you're smoking an opioid, many drugs these days are laced with fentanyl, unfortunately, so you could still overdose. But a friend nearby could give you Narcan to reverse the overdose and save your life. Hygiene is also really important when it comes to smoking. Make sure to clean the tip of your pipe before you smoke, wash your hands in the area in which you plan to smoke, avoid sharing materials if possible, and avoid reusing materials like foils when freebasing if possible. As I said, it's pretty easy to get burns when you're using a glass or metal pipe, so make sure to clean the tip or mouthpiece of the pipe before you smoke, ideally with an alcohol prep pad. It's also a good idea to clean your hands in the area in which you plan to smoke before you do smoke, because this kills off germs and decreases your risk of infection. Try, if possible, not to share pipes when smoking. Hep C and HIV can be passed from sharing materials if you and a friend have open wounds or burns. It only takes one drop of blood to transmit infections like these. If you need to share, try to clean mouthpieces thoroughly with an alcohol prep pad. If you're freebasing with a substance like coke or heroin, always try to use a new foil if possible. Freebasing is when you use chemicals to turn a drug like coke or heroin into its purest form. When something is freebased, it's usually easier to smoke. Try using the proper materials when smoking if possible. If you're using a pipe, avoid crack ones because they could cut you. Additionally, try to use a metal screen with a crack pipe. Screens act like a filter and help to cool the pipe. Brass screens are ideal, but they're a bit tricky to find, so Brillo pads are the second best option. And they're usually available at most department stores where cleaning supplies are sold. Before you smoke, try to keep your lips moisturized with lip balm. This decreases your risk of getting skin cracks and bleeding on a pipe. After you finish smoking, apply triple antibiotic to all of your cuts to help them heal faster and to avoid Hep C and HIV. Try not to add triple antibiotic to burns, though. Finally, try to rotate routes of consumption. Avoid continually smoking if you can without letting your body heal. This could aggravate wounds and lead to greater forms of infection. Instead, try consuming substances in a different way after you smoke. You can check out our videos on other routes of consumption in MaineGeneral's Harm Reduction YouTube playlist. Thanks for joining me today to learn more about smoking. We talked about how smoking works, commonly smoked substances, risks associated with smoking, and some risk reduction strategies. At Next Step Needle Exchange, we offer a variety of supplies, including alcohol prep pads, triple antibiotic ointment, Narcan, condoms, lip balm, and more. These materials help create a safer environment for substance use, reducing the risk of infections and other complications. Thanks again for joining me today, and I invite you to check out more of our content located within MaineGeneral's Harm Reduction YouTube playlist.